We are in the middle of Stroke Awareness Month, and it's a very important topic to make sure that you are thinking of constantly in terms of the signs, the symptoms, the risk factors. So Dr. Christopher Southwood from Infirmary Health is here to go over all of that. And we were talking about how really this is an everyone problem. It's not young or old. We know some of the risk factors, and we'll refresh those for those who may have forgotten. But I want to talk about the non-traditional risk factors.
Yep, so for sure. So some of the stroke risk factors we think specifically for young people to be aware of. Some of the ones that we see are patients who come in and they have sleep apnea.
Yep.
So again, that tends to be a patient who is overweight, has trouble breathing. They may stop breathing at night. We've had significant stroke data that has come out in the last few years that have said treating sleep apnea will significantly reduce stroke risk.
Yeah.
Being plugged into your sleep doctors is a big key there. Young patients, again, it's hard to know. 1 out of 5 patients have a patent foramen ovale or a PFO that may be related to strokes. There's some link with migraines with that. But for sure, anyone who's noticing that they've had these sudden onset weakness, numbness, dizziness, speech changes, vision changes, that's something to take serious at any age, but it tends to affect those younger patients. We have autoimmune diseases. Things that, like lupus, can increase your clotting chance.
We're hearing more cases being diagnosed. So,
absolutely.
You know, you mentioned the symptoms also in talking about the risk factors. And let's talk about those again, because sometimes it can be difficult. You don't know if a person is tired or... So let's go over those.
And so, again, normally strokes will present with half the body going weak, half the body going numb. We use the B-FAST mnemonic. So we're talking about balance being affected, eyes that can be double vision or droopy eyes, face asymmetry, arm weakness. So if one arm is weaker than the other, again, speech changes, so slurred speech or problems getting words out or understanding. And then lastly, we use T for be fast for time, meaning you got to get to the hospital right away. Some people use terrible headache. That's for if an aneurysm has bled.
Okay. I want to talk about the accreditation for the facility. And break down what that means.
Yeah, so we're actually really proud about that. So we are the only Joint Commission Comprehensive Stroke Center between New Orleans and Naples, Florida. So along the Gulf Coast, we are the only place that meets the Joint Commission standards. We have 24/7 care for our patients with a complex neuro ICU. We can provide complex neurosurgical and endovascular procedures. We have advanced imaging that we can provide. Like I said, we have our complex team of nurses. So we have our nurses that can meet the patient in the ER. We have our doctors on ready to respond. Neurosurgeons in case of an emergency, rehab teams with our therapists and doctors as well. So we can really follow the patient the whole way through.
I'm glad you talked about rehabilitation, time and responding to a stroke. They go hand in hand. The treatments are there.
Yes. Yes.
And you can go on and live a full life after having an event.
Yes, I've actually just this last week had a patient came in, he was paralyzed, he had to crawl to get to the phone, and he was able to walk out of the hospital the next day.
How about that?
And we have extended our time windows, so we have up to 24 hours for a lot of our the mechanical thrombectomy procedures that we provide, but we've even extended our windows, and we're using a more effective blood clot busting medicine. It's called TNK.
Okay.
That has an improved efficacy compared to what we used to use when this was approved in the 90s.
And as we're wrapping up here, we're out of time. What's the call to action for people watching?
Yeah, so certainly call if you see a sinus of stroke, call 911, get to the hospital right away. Ambulance gets us there faster. We know you're coming, we're ready for you.
Okay, well, thank you for stopping by.